Fantastic. And then lastly, sharing the screen. Good. Okay, so I think we are ready to get going. We're hitting 9 o'clock, and you guys are busy people. So, yeah, welcome to presentation number two for our milk break. The title of this presentation is called Parlour Pitfalls. And yeah, we're really excited to have you here for any people that have just joined more recently. Things that we should go over before we dive into it. Please feel free to use the chat and Q&A functions. I will not be able to see those as I'm going through the presentation, but I will make sure to address all questions or comments at the end. The maximum length of this webinar is going to be 1 hour. I don't intend to be talking for that long at all, but if anyone wants to stay afterwards and have a conversation about some things or some questions that arise during the presentation, please feel free to do that. I'd be more than happy to run through that with you. We've launched the poll. We've started recording, so it looks like we're ready to get going. So welcome, everyone. Today, we're going to have a couple of really interesting topics focused on what we do in the parlor. So we're going to tell you a little bit about myself, what the goals of Milk Harvest are, and then how we can optimize milk letdown, teat dip management, and management of other sanitizers on farm. Okay, so for those of you that are new here or haven't met me yet, my name is Mike. I am a vet at Upper Grand Vet Services and graduated from the Ontario Veterinary College in 2022. So we spend an awful lot of time at the clinic focusing on the number one disease of lactating dairy cattle, which is mastitis, and try to help our clients through improving udder health and milk quality. Some of that involves spending time in parlors or at milking time, even watching automatic milking systems, uh, analytics, things of that nature to try and help people have a little bit more fun milking cows. And we like to think that as partners in your milk quality and udder health journey, that together we're mastitis' worst enemy. Okay, so we're going to start with a bit of a level set so that we all know what context we're talking about for the recommendations that we're making today. So we should all have similar goals for milk harvest. So we want to be clean when we're harvesting milk. We want to be gentle to that cow. We want to be fast, and by fast, we don't really mean get her in, get her out as quickly as humanly possible. But what we mean is don't spend any additional time that we don't need to improve either parlor efficiency, robot efficiency. So we want to be really reasonable with people time. And we'll touch a lot on that in this presentation. And then complete. So complete meaning that the cow is done milking, not necessarily that we've squeezed every drop of milk out of her, but that she is completely milked out to the point where she's not going to be leaking any milk following harvest. Okay, so this is kind of the framework of what we like to work on. And I'd like you to keep these pillars in mind as we go through the presentation because they're all critically important to improving the milking experience for four-legged creatures and two-legged creatures as we harvest milk. Okay, so the first thing that we see, probably one of the most common things that we encounter in milk harvest, is having letdown. So falling short on optimizing the ability of that cow to let her milk down completely and quickly. So why is this important? We probably talk a lot about milk letdown and breeze past some of the reasons why it's important. So letdown is important because a good letdown will increase your milking speed and milk out. So decrease the turn time or box time for automatic milking systems. So decreasing the amount of time that she spends in there and decreasing the amount of time that that equipment is allocated to that cow. Okay. Letdown is also important for cow comfort purposes. So Um, in the absence of a good letdown, that is going to be incredibly uncomfortable for the cow, and we'll talk about that in a minute. And that is directly related to operator satisfaction. So, a lot of challenges that operators have, thinking about kickoffs, thinking about premature detaches, unhappy cows in the parlor, cows that are difficult to manage in a milking system, can be related to milk letdown. So, um, to understand letdown, we do have to understand a little bit of the anatomy of an udder. So a nice little cross section here. Okay, there's kind of three big parts that I'd like to focus on here. So we have the teat and the teat cistern. So this is the part that we can detect and can put our hands on and see really well. Okay. Above that, we have the gland cistern. Okay, so milk can be stored here as time goes on, and this is a storage chamber, okay, for milk. And then above it, we have, the $50 word for that's the parenchyma, functional tissue. We could call it the alveolar tissue, but inside this tissue is a bunch of really small alveoli, or we can think of it as little bubbles of milk producing tissue. So they fill up and they are surrounded by a little bit of a muscle structure. But this is the bulk of the udder is going to be all this functional alveolar tissue. Okay, so alveolar tissue, big storage gland, and then the teat. So to understand letdown, we have to understand where the bulk of milk gets stored. So even though we can, in this diagram, look, check all this milk out, there's only about 20% of the milk that a cow is carrying at any given time, or at milking time, is going to be in this gland. Okay. 80% of it is stored in these itsy bitsy tiny alveoli higher up in the udder. Okay. So we need to understand pretty completely how to get at that 80%, because we can milk out this 20% really quickly. And having the cow behave in such a way that we have this 80% drop and be let down um, as we run out of this reserve is going to be really, really important. Okay, so the key to all of this is going to be a hormone that we're probably all familiar with is oxytocin. So oxytocin does come in a bottle. I'm sure that is something that a lot of dairy farmers are familiar with is injectable oxytocin. So sometimes we'll use that for cows that struggle with milk letdown. But believe it or not, the cow does a fantastic job of producing that hormone under optimal conditions for herself. So how do we get oxytocin? Well, oxytocin is naturally released when we have really, really good udder stimulation. So if we think back to this cow and her ancestors, they had an oxytocin release when a calf suckled on that udder. So that stimulation of the calf mouthing on the udder, sometimes bunting that udder, that actually is nature's way of stimulating milk letdown. Okay, so the important things are for that cow is that there's stimulation. That stimulation talks to the brain of the cow, where there's a gland called the pituitary gland. That gland releases oxytocin into the bloodstream. And what that oxytocin actually does, I'm going to flip back, that oxytocin causes contraction of these little bubbles where 80% of that milk is. So that provides that milk letdown, that full and complete letdown. But that does take time for the stimulation to reach the brain. That's pretty quick. But then for the oxytocin to release and actually reach the udder takes a little bit of time. In fact, there's a recommendation of having 90 seconds between a good vigorous stimulation and attaching the unit. That time is usually agreed upon as optimal because we can still collect milk from that cistern and not have it run dry by the time we start having that letdown cascade. So if we look at this picture, I'm going to emphasize the fact that this person's wearing gloves because that's awesome for hygiene. I will do that every time. But when we talk about a good stimulation that is either a good solid pre-strip that is going to be a good cleaning or wiping. That's going to be something that provides that good stimulation, and the more stimulation, the better. Uh, I know that can be sometimes people think, oh my goodness, how much time does he want me to spend? We're talking about increasing efficiency of milking time, but we'll see in a second how this step can actually really improve. Like a couple of seconds on the preparation side can really improve the amount of time it takes to milk a cow and how comfortable that is. So people think, oh my goodness, how am I going to achieve this 90 seconds? Well, we can do that in a couple of ways. So we'll start with automatic milking systems. So we can change our settings on those to change the amount of, some people call it, some companies call it treatment time, some will call it prep time, but how much time we're actually cleaning and stimulating those teats. So that is one way that you can do it in that system. In a parlor, you can select how many cows are in a prep sequence. So am I going to, let's just use the example of strip, dip, wipe. So in that setting, if I'm doing a good thorough strip, and then dipping the cow and then wiping the cow afterwards, am I getting this 90 seconds between the first time I stimulate that cow and unit attachment? Am I getting that when I'm prepping 3 cows? Am I getting that when I'm prepping 2 cows? So you can adjust how many cows are in that sequence. Often we see 4 as a really good one for a parlor setting, um, to get that 90 seconds and get that good letdown. Um, that we also see, we'll talk about how we can add a little bit of time based on what our pre-dip is or a pre-treatment is later in the presentation. But this is really easy to evaluate yourself, or if you milk with a partner, just see how long it is from when you first touch that cow to when the unit goes on, and that is a good cheap way to evaluate whether or not we are giving the cow enough time. Okay, so why are we so focused on on this? Why is letdown important? So this is a really technical looking graph, but I promise you it's super easy. So high flow means low vacuum pressure. Okay, so what this is, we can only focus on the focusing on the black and the green is going to be important. This is pressure at the teat end. So this is we have equipment that can measure pressure throughout the vacuum, or I should say vacuum, throughout a system, especially at the cow. And in a really nice milk out, we have nice flow gets started, really good flow, low pressure throughout. And then when there's no milk left, we see pressure increase and the automatic takeoff, or the very astute operator is going to remove the unit. Nice and low pressure or vacuum is incredibly comfortable for cows, and when this is predictable, it creates a really nice milking experience. So this is going to be our perfect pie in the sky milking. Okay, we have that by doing an appropriate preparation. We have this fantastic letdown, and a very comfortable experience for the cow. Okay, so we've done a lot of talking about how we can make letdown work really well, but it's imperative that we talk about some of the ways that we can get in our own way of having this letdown happen. Okay, so the biggest enemy to this nice oxytocin cascade is going to be stress. So when we think about stress, we can call it cortisol, we can call it adrenaline, whichever, but anything that is going to make the cow uncomfortable in the moment, or if the cow is anticipating discomfort, pain, or something scary, that is going to really get in the way of that oxytocin doing its job. Okay, so this is a really wordy picture. I have some more visual stuff on the next slide, but we're talking about here anticipating or experiencing pain, being hit, or high vacuum, or fear. So those are the really big ones. So some of these are a little dramatized, but I want you to get inside the head of a cow and think about what things make her nervous and what things make her scared. So if she's coming through a breezeway to go to the parlor and she can't see anything, She doesn't know, she's unsure of her footing. Maybe it's slippery. That is going to be something that causes anxiety. It takes a long time for that cortisol to come back down once they have it. So likewise, if someone's chasing her into the parlor with a stick or screaming at her, that is going to be something that really raises that cortisol or that stress level and is going to block the ability of oxytocin to do its job. Other examples, is there a dog barking as you're going to go fetch cows that maybe is a little more aggressive for moving cows than you'd like? Um, there was one parlor that we visited where the morning milker really liked his techno music, and he was the only person that did this. But I walked into the parlor, really loud music in the morning, and very jarring for the cows. That is something that they are not accustomed to. That's something that can sound threatening, especially because they have such sensitive hearing. And so that like having some just mindfulness over the sounds that are happening at milking time, that may or may not get in the way of good letdown. The other thing here is we have pain. So this picture is supposed to represent mammary discomfort. So things like udder edema, things like mastitis, things like um, anticipating an uncomfortable milking because the unit is on for too long, or this cow has experienced lots of bimodal milkings in the past, which we'll get to in just a moment. That is something that can really interfere with our letdown. So I hope that from this presentation, you can go to your next milking and be really critical about, am I being consistent? Is the milking experience consistent between operators? So if you do morning milking and someone else does evening milking, um, are the cows experiencing the same calm, predictable environment? And are they are we giving oxytocin the best chance to do its job to help us out during the milking procedure? Okay, so when any of these fearful or painful things happen, what do those milking graphs look like? What does the cow experience? Okay, so the colors are a little bit different. This is a cow that we observed, but so the red and the black are the teat ends, vacuum at the teat end. So what happens is we had a depletion of that cistern, so really low vacuum. We ran out of milk to draw into the unit, and pressure goes up. This is uncomfortable. This is cows can actually detect a very, very small change in vacuum at the teat level. So this is very uncomfortable. She notices that for sure. And then this is bad not only for the fact that it's uncomfortable for her, but it also increases unit on time. So the time that she was in this kind of bimodal milking was about 30 seconds, and this particular unit I think was on for 4.5 minutes. So this bimodal event was more than 10% of the unit on time, which is going to be really, really important for milking efficiency, whether you're in a robot or a parlor. So, if this was just, let's just pretend this is a prep problem. We're not giving her the 90 seconds between a really vigorous stimulation and unit attachment. Say we only did a half-hearted kind of brush by of the teats. If we had spent 10 seconds longer on stimulation, we could have eliminated this entire uncomfortable, lengthy, and not very useful part of the milk harvest. Okay. So the other thing that I alluded to earlier is if cows are anticipating this uncomfortable event, especially if they're sensitive, udder edema, maybe even heifers especially because they can get really wound up with that new experience, fresh heifers, they can learn to anticipate this. And if they're consistently anticipating having a bad time being milked out, are just going to spiral out into this. We have taught this cow that this is uncomfortable, and the fact that she experiences that discomfort and learns to anticipate it, makes it really hard to undo that. So it's actually critically important that we try and make sure that this milking procedure um, and handling of animals around milking is as uh, calm and predictable for these animals as possible. Um, because we don't this is uncomfortable for the cow, but like I said earlier, this is what gets you your kickoffs. This is what gets you dancing cows, kicking cows, and so that is not only uncomfortable for the operator, but if too many cows start doing that, you start to get a frustrated operator who may be less patient, who may be a little more aggressive with moving cows. So we want to make sure that we're doing everything we can in a preventative fashion to decrease the likelihood of these things happening. Okay. Now, there is a longer term consequence to having um, really high or higher vacuum or exposure to high vacuum. So basically, the longer we expose a teat to high vacuum, the more damage we do to it. So the big ones for that are potentially over milking and this bimodal milking. We can think of it like calluses on our hands. So people will see these teats, these really rough teats, and they'll be like, "Oh, that's blown out. Well, you've sucked the inside of the teat out." That, in fact, is not actually true. These kind of fronds that we see in these rougher, very rough teat ends, those are actually keratin or additional skin being put down in response to being damaged. So if you think the calluses on your hands are from working hard and being damaged by use, and then we develop these calluses, that's the exact same thing that happens with teat ends. So this can be problematic for a couple of reasons. Number one, very uncomfortable. So these very rough teat ends, you'll notice if you're seeing these at milking time, that might be a cow that is less comfortable while being milked. And the worse they get, the more painful they can be. So that's one problem is we're reinforcing this poor letdown. The second thing is that we're functionally, no, we're literally increasing the surface area of this teat. And so this nice, smooth, super, super healthy teat has a very low surface area relative to this with all these finger-like projections coming out of it. And that is very relevant because the higher the surface area, the more difficult it is to do a good job cleaning during preparation. And the more bacteria can hide out in there. So it creates this perfect environment for a mastitis case because of the difficulty of cleaning and the amount of organic matter that can actually be on that teat end. Looking at these, like if you see these rough teat ends, I really encourage you to work with your animal healthcare team. If you're seeing a couple of these, it is very valuable to go through the herd once or twice a year and see where they're at. If you are seeing a lot of rough or very rough teats, that is a really good indicator that we can do maybe a better job with either our equipment settings or we can work on preparation and animal handling to ensure really good letdown and limit our exposure of these delicate teat ends to painful high vacuum. Okay, so there's lots of pictures online. You can go through this, but just to go over these with you so you can think about them at the next milking or the next time you're in the robot. Um, no rings, just nice and smooth, almost kind of a dimple at the end of the teat end. So that's the normal state, very, very healthy. The smooth or slightly rough kind of looks like a bit of a bullseye. These actually happen to be the optimal for preventing cases of mastitis. I don't know why. I think it has something to do with just a confirmation of the teat end. But these ones and twos are really good. As soon as you start getting, they may look a little bit brown, but it's we'd call them rough if you ran your finger over them. The clean teat, you would feel these little bumps kind of in a they may look like kind of marks on an analog clock, but that's going to be rough. And then when you start getting these little fingers coming out of the end, we would call that very rough. So these can be your canary in the coal mine to indicate that there's something incorrect with procedure or equipment. Okay, cool. So we got through the first one. We've talked all about how important letdown is. The second thing that I'd like to discuss today is going to be attitudes towards post dip and how we can get the most out of our post dip. So, first thing that's really important to understand is why are we doing post dipping? So, post dipping is really good for preventing contagious mastitis. Okay, so think of your Staph aureus. That's going to be the most relevant one where we are. And then the other thing that they do is improve Tate skin condition. So that is going to be your emollient package. So basically your moisturizer. And so that not only makes the skin nicer and healthier and more moisturized, but it prevents drying out and cracking, both which are painful and make teeth harder to clean. So keeping that whole teat healthy is going to be really important as the cow goes through her lactation for not only milkability but also hygiene. Okay, so this again, all the pictures of gloves in it. That's awesome. We love that. It's a good hygienic step. But this is, I would say, as close to a perfect dip as possible. We have the teats covered all the way up to the base, and this dip appears to be on in like a good amount. You can't tell whether it's dripping off rapidly in this picture, but like that to me looks great. I'd give that an A plus. Okay. Now, there are some people that are very satisfied with only this part of the teeth being covered. I hear Dr. Mike, the teat end is covered. That's the only important part. That's all that really matters. Dip is really expensive. I'm pretty sure in the at least the OMAFRA survey of costs says that teat dip is like less than 1% of all costs on farm. But mastitis is incredibly expensive. I cannot impress upon you enough how expensive every case of mastitis is. So a couple of extra dollars over the course of the year is going to make a really big difference. Okay, so these would be our danger zones for teat dip attitude. Is just need a little bit of dip at the end of the teat. That's going to be fine. Keeping in mind that Staph aureus lives on all skin. So we have all this area that would potentially still have Staph aureus on it. And then all this teat skin is not getting the emollient package. So that's important. So then we would say like, okay, this is our medium. We're getting a little bit better, but not quite. And then like that last picture, this would be our gold standard. Okay. So cost control is one concern that people have. The other one that we see quite often is the operator can't see if they've done a good job. So whether or not that is poor lighting, operator comfort, or they're not being told to expect to be evaluating this, that's something that can get in the way. I'll show you some pictures, and then we just talked about already the teat end coverage. Okay, so we're going to go through some examples of teat dip coverage not being optimal. So this is a setting where teat dip is applied within the cup. And so let's just look at a couple of these teats. So this cow here, so actually let's go back and look at the really good one. Okay, so this is like A plus. We're doing a great job for skin health and preventing contagious mastitis. Okay, in these teats over here, we have pretty sparse coverage. Whether or not the dip went on appropriately at the time the units came off, I don't know. We have this, okay, we have this little drip at the end of the teat end, sure, but we're leaving a lot blank. And in fact, over here, we have almost no coverage. Okay, so these animals are all the same system, but okay, so really poor coverage, questionable coverage. This one is a different animal, but likewise, right? Like not we have that little dip at the end. We're not doing too much for teat skin health, and then we have all the Staph aureus able to proliferate um, on that teat end. And here we go, another one that is that's not covered very well. So this may in fact be this you'll notice this front right and this front right are poorly covered. That actually was an equipment challenge, which the line wasn't connected appropriately, but the employees were not instructed to be looking out or analyzing whether or not the teats were being covered appropriately. So if that's not brought to their attention that this needs to be repaired as quickly as possible, if they're seeing that, you may go an entire milking without applying post-dip to a teat. Um, the other thing that I should mention is these employees also were had a dip cup on hand to correct any deficiencies in post dipping, so they were empowered to do that. But again, it wasn't really emphasized how important it was to cover the whole teat. And so they would see something along these lines and say, "Oh yeah, there's dip on that teat, good to go." So going back to we want that coverage, um, and that is really really important both for owners and operators that coverage does happen. This next one, I really enjoyed because it, and I think any outside source would have caught this right away, but because it was normal on this farm, um, they had no idea. This tape, so the operator would be, if you can look at my laser point, operator's kind of right here. They have an awesome spray bottle that gets, teat dip or you call it post-it, whatever, you know, at kind of sprays it out, even coating. If you were looking from the perspective of this bottle, that teat looks like an A plus, right? Good coverage, tip to base. The operator or the evaluator, which was me in this case, kind of tilted their head to the side where we get a little nosy during these evaluations and saw that this half of this teat was not being treated, including, it's hard to see here, I had to change the contrast of the image to really highlight this, but um, half the teat end isn't even covered. So this is something that can happen. So we'd call this a spray or an application error. And this can happen to people. This can happen to automated systems. So it's very important that we don't let the day-to-day kind of mundane or boring escape our view as leaders or as operators. It's very important to be every now and again have a critical look at your milking procedures, and that's when these really jump out at you. Like if you're dealing with high bulk tank somatic cell high or high back to scan. Very often these errors, especially even in pre-dips. So let's just say this is a pre-dip. None of this has been disinfected, and then we are putting the milker on that. So any bacteria that was not killed is now entering that bulk tank. So these are just some things to be aware of. Are we doing it well? And are we making sure that we continue to do things well? So this herd ended up switching to a more traditional dip cup for better coverage. Okay. Okay. So we're done two. We're going to go through one more before we get to some questions. So the third thing that we see sometimes being a bit of an opportunity for our producers is mismanaging sanitizer. And I'm calling it a sanitizer because sometimes people use a tea dip or a spray or but anything that we're applying to teats to sanitize the teats, we call it a sanitizer. So and there's tons out there. So managing them is going to be very important. And the way I like to talk about this is so if we look at all of these animals, okay, we got a big beef bull, really fancy looking dairy cow, whatever you want to do. I don't know what this animal's job really is, but we see these and this calf. They're all cattle, right? But we manage all of these cattle differently, right? So it's very important to know that all these teat sanitizers or teat dips, yes, they all sanitize teats. No, we cannot manage them all the same and expect the same results. Okay, so um, Really, really crucially important, especially when you're changing teeth sanitizers, is that there are different labels and different instructions. So I pulled up two labels here. Not going to try to get into the weeds and bore you with all of the particulars, but you'll notice this 4XLA, which is a very common one. It's a non-iodine dip, but this one says mix only enough product for one milking of the herd. Dip cups should be washed after each milking. So this is a product that has to be made up for that milking and then is no good after the fact. Okay. It also says leave on the teats for 15 to 30 seconds. Okay. Those are two really important parts because if you are using what we would call a tired or quenched or exhausted dip, you're not getting any bacterial kill. And then this particular product needs 15 to 30 seconds to do that. So we have seen in the past products being used like dipped and then immediately wiped, and we're not obeying that contact time for the product. And so effectively, we're spending the money on the product and we are not letting it do its job. So if that's something that you guys see in your herds, or that's part of your milking procedure where you dip the cow and then before leaving the cow, you wipe the cow, please keep contact in mind in time. So look on those barrels, look on those jugs. This is an iodine-based teat dip here, and I try to stay away from product names. I should have said that at the beginning of this slide, but to get the actual labels, I want to be really specific. So this is an iodine one, but here they say, okay, if a common teat dip cup is used for application, a fresh solution should always be used at each milking. Okay, so this one is really focusing on making sure that we're not using, that we're cleaning out anything that has previously been used or may have had organic matter in it. So that's an important consideration. This one also happens to be a 15 to 30-second contact time for pre-dip, but that is not the same for every type of teat sanitizer. Okay. So where we see a bit of a challenge for these is when someone gets talked into buying or decides to buy a different product. Uh, they may make an assumption that the way they handled their previous product is going to be the exact same way that they handle the product that they're now using, and so that can kind of lead to some execution errors on the side of the sanitizer. Okay. So the other thing that we have to manage is how we're actually applying the uh, the dip, and so what vehicles we're using. At this particular farm, so that I remembered later, one was pre-dip and two was post-dip. So that's all that is. But just because there is a sanitizer or a soap or a cleaning agent in something doesn't mean it's particularly clean. So, we're seeing there's a little bit of straw in there. There's a little bit of straw here. That can, depending on your dip, be well, it is detrimental to the ability of those to clean, more severe for different teat dip types. Okay, and recommendation always is going to be that at the end of a milking, this top part in this style cup is discarded, and then you wash the top of this before you go again. Okay. Likewise, these thrifty style dippers. First of all, sometimes these do too good of a job of removing post-dip. So that's something to keep in mind. Like, is this thing scraping off most of the good stuff that's going on teeth? And the amount of surface area for this is incredible. And not only does some of these bristles get a lot of residue on them, that may not be how do I say, like, sterile or clean. So these bristles actually may be contributing to harboring some bacteria, and then we're putting that onto every teat. So recommendations for that are make sure you're washing or cleaning these parts of your applicators, and then to kind of go with that, we want to make sure, and this is probably going to be on almost every label, do not pour anything back into your barrel, your teat dip barrel. So things only come out of that. If we say we were to pour the contents, just for the sake of argument, of this dip cup in there that's got some organic matter. We are now seeding our cleaner with organic matter that has bacteria on it. So organic matter being manure, bedding, um, anything like that. So that's very important. You know, it's same old, same old. I've had the same dip cup for years and years and years, but that doesn't mean that they don't need to be cleaned or maintained. I would also really challenge you to see whether or not this thrifty dipper is giving you that good A plus coating of a teat that we talked about earlier. Okay. This is a bit of a case study, but just a caution for people that are using either home brews or this in particular was a home brew situation, but very, very important to evaluate your dip and or your sanitizer and the application thereof. So this client had a Bactiscan and mastitis problem culturing lots of Staph aureus cows. When we went to evaluate their milking procedures and systems, they told me that they created a monthly mixture. So at the beginning of the month, first of the month, they'd put together some hydrogen peroxide and some soap. Um, and so hydrogen peroxide notoriously does not really, when it comes to contact with organic matter, does a really good job and then gets really, really tired. So if one piece of straw or one piece of manure gets into the solution, it loses its effectiveness very quickly. So this person was mixing that up monthly, and we actually cultured their pre-dip and did a bacterial count. So this translated in English is 8,200 bacteria per milliliter was present in the pre-dip cup. So in our sanitizer, what we thought was going to be sanitizing that teat end and preventing mastitis was actually adding bacteria to it. And later on, we did a more specific culture looking for what species were in here, and we did find Staph aureus in that dip cup. So really, really tragic outcome, but I'm glad we caught it and can start managing it. But we really, really, I'm happy we did this, and this is quite cheap. Like figuring out how much bacteria is in something is gonna be probably in around the $50 or less range for fluids, and we identified a huge limitation of the procedures for this producer. So, um, following basic principles. So if you're using a peroxide based dip, understanding that presence of organic matter is going to make it really difficult for that to work. And then maybe every now and again we validate what we're doing and double check whether or not we're doing what we're expecting to do. Okay. So key takeaways from today's presentation: slow is smooth and smooth is fast. Taking your time with those cows, doing a really deliberate job of prepping them is going to actually increase the speed at which a cow goes through the milking procedure. Okay, so I always like to say slow is smooth, smooth is fast, and both your cows and your milkers are going to appreciate that attitude. Dip coverage is going to be critical, and we often overlook it and don't really appreciate how important it is to have good coverage of that entire teat. Dips must be managed differently, and we can evaluate whether or not we are applying a product that is going to have a low bacterial, really okay. I really and yeah, I really appreciate everyone being here today. I am super happy to get to talk about one of my favorite topics with some excited folks about it. Just as I wrap up here, please feel free to use the chat function, the question and answer function, and I'll get to those in just a sec. But you can see us on Facebook. I manage that page. I also kick out a free newsletter every 2 weeks. Quick 3-minute read on product you might not have heard about, some treatment tips, other quick pieces there, and then here's a link to our website. You can reach me about any questions, specifically udder health in the context of this presentation, at this email down here, and I'd be happy to get back to you and start a conversation about your udder health or milk quality journey. Okay, so with that, I'm going to leave this presentation. Maybe that'll stay up for us. hopefully that'll stay up for us. Let's see how it goes. Oh, I do have access to the Q&A. Okay, I don't have any questions here. I don't have any chats here. Um, but I'm going to kick around. There's 15 minutes left in this presentation, so I am really, really happy um, to stick around for any questions for the next 5 minutes. If there's nothing, then I hope you all have a wonderful day and enjoy this sunshine if you're in this part of the world. Thank you everyone for coming, and excited to host the next one. Thanks, Rick. Thanks, Nicole. Okay, I think that's it for me today. It was, for those of you that are still around, it was an absolute pleasure to get to talk about udder health and milk quality with all of you, and I hope you have a wonderful day.